Biomechanics of the front squat. It is important to know that the squat is typically used as a screening tool to assess functional mobility of the hips and the knees. Here is the movement in action. Shoulders are adducted and flexed, while the scapula and the clavicle are elevated in an upward rotation. The lumbar spine is in a neutral to slight extension. The hips and the knees move in extension during the ascending phase. The ankle joints move from plantar flexion on the ascending phase. The elbows are flexed while the wrists are in hyperflexion to stabilize the bar. Here are the eccentric contractions that are happening during the front squat of the downward phase. Here are the concentric contractions happening during the front squat of the upward phase. Muscle activation that is occurring during the front squat are utilizing the deltoids, the latissimus dorsi, the triceps, the trapezius, finger flexors, and the wrist extensors. The core muscles are also helping to maintain proper alignment, the rectus abdominis, the erector spinae, obliques, the transverse abdominis, the hamstrings, and the gluteus maximus. During the downward phase, knee flexion from the quadriceps, contracting eccentrically, the ankle joint dorsiflex by way of eccentric contraction of the gastrocnemius. These are the muscles that are being measured by the EMG found in the rectus femoris, the vastus lateralis, the vastus medialis, the biceps femoris, the semitendinosus, and the erector spinae muscles. Every movement has a position, velocity, and an acceleration. There are two classifications of joint movements to apply to the front squat. Linear translatory is demonstrated when the body moves from a standing position to a squatting position and then in reverse. Rotational movement is being demonstrated while the shoulders are being held up at the shoulder joint and the hips and the knees during the squat and also in reverse. Angular displacement. One needs to be able to transition from 0 degrees of dorsiflexion to standing to 35 degrees of dorsiflexion at the bottom of the squat. This will positively affect the ability to perform the move effectively. The angular shown identify the individual's full range of motion capability for doing the front squat. Load position and lever length would have a direct effect on the angular rotation of each respective joint. Newton's law states that an object at rest will stay at rest and an object in motion will stay in motion unless acted on by an outside force. This is good to know because it is important to make the movement meaningful. There must be right level of resistance to maintain good form. During the front squat, the barbell is the object at rest. During the descending phase, the body produces a force to decelerate the bar. It creates the same response for ascending phase. Muscles, tendons, and joints are also recruited to execute this exercise. Newton's second law, acceleration in the case of the front squat. The mass is the lifter and the weight. They are constant. The lifter applies the force to the weight to rise it. Acceleration of the weight occurs because the force is greater than the weight. Any other squat movement will need force greater than the weight to keep the weight stable and acceleration. Newton's third law states that for every action there is an equal and opposite reaction. For the front squat, if enough force is applied, there will be controlled movement in all three planes. Here is information continuing Newton's law concepts at play. What is happening during the squat exercise? Torque force is necessary. If the knees do not travel forward during the barbell squat, the quadriceps or the knee extensors are not significantly loaded. Also, injuries could occur if there is an excessive force. Squat corrections if there are performance issues. If an individual has a history of knee pain associated with these types of movements, then there could be an issue. Also, the squat can be modified to place more torque on the hips. and consistently less on the knees. Also, they may not be able to squat all the way to 90 degrees due to both hips and knees not being experienced well enough to withstand the greater forced work. Research has shown that velocity and acceleration can decrease at the knees as the load increases. Some athletes move into flexion of the knee joint at the slower rate to withstand the increase in load. Research has suggested that the technique allows the athlete to maintain proper lumbar curve. Front squat exercises or movements that can be improved by performing other exercises. Strength and athletic development. Improve strength, enhance force, time development, power, general skills, and performance. Strength and injury prevention. Strength training reduces sports injury to less than a third and overuse injuries by half. Hang cleans and squat training. Concurrent hang clean and squat training improves vertical jump performance over squatting alone. Vertical jump and on-ice performance. Vertical jump high is strongly correlated to on-ice acceleration and speed. Vertical jump, by improving front squat strength and technique, there could be carryover to hang clean performance. The carryover and improved hang clean execution can lead to increased vertical jump height. Front squat key points: condition and demand on balance, hip extensors movements, muscle recruitment, and then front squat key points continued. This concludes the presentation.